Okay, great. Thank you very much. As the Delta variant spreads rapidly through the United States, as well as our own community, we have reached a point where unvaccinated people have one of two choices: either get the vaccine or get COVID. That's how infectious and dangerous the Delta variant is. We are here today to strongly recommend that you choose the vaccine. Just glance at the news and you will see story after story of unvaccinated, infected people expressing their regret over skipping the shot that could have spared them from serious illness or death. You may have seen the story yesterday of the unvaccinated 39-year-old Las Vegas father of 5 who developed COVID and died within days. The last text he sent his wife read, quote, "I should have gotten the damn shot." Unvaccinated people who are infected with the Delta variant are becoming seriously ill, and people are dying from a largely preventable illness. Please don't become one of them. We are all tired of this pandemic, and we want it to end. We want to get back to normal, and we can. We know how to get there. If you are not vaccinated, please do so. Vaccinations are free and easy to access. If you're nervous about or afraid of taking the vaccine, please reach out to your healthcare provider or staff at Public Health Madison-Dane County. They are happy to listen to your concerns and answer any of your questions. But please don't wait until it's too late. In addition to individual action, we need employers to step up too. Dane County government has a large workforce, and our priority is to keep our workforce and the public with whom they come into contact as safe as possible. To this end, Dane County government will now require all of our employees to provide proof of vaccination or a weekly negative COVID test. In addition, we will require all county employees and visitors to county-run facilities to mask up before entering buildings. The Delta variant doesn't mess around. We will do what's needed to protect our workforce and those they serve. With Dane County now requiring our employees to be vaccinated or show negative test results, I urge other employers to do the same and require your employees to show proof of vaccination or a weekly negative test. Some area companies are already doing this, and I hope others will join them. Some area nightclubs are also requiring proof of vaccination in order to enter. We support those efforts too and encourage others to join them. We all need to work together to encourage as many people as possible to finish the deal, to get vaccinated so we can all return to normal. Lastly, there's a group of people who are not yet able to get vaccinated, a group that we as a society are entrusted to care for, our children. Children under 12 are not yet eligible to receive the vaccine. They are therefore vulnerable and need us to watch out for them. And please remember, the Delta variant is not last year's coronavirus. It's much more serious. We must protect our kids, and we can do that by getting vaccinated. The CDC has also recommended that all schools utilize masking this fall. While Public Health Madison-Dane County does not have the authority to mandate masks in schools, they do join the CDC in urging schools to adhere to this recommendation to mask up. So that's where we're at. COVID is back, it's contagious, it's dangerous, and it's threatening our recovery. But this time we have a choice. We have a vaccine. It's safe, it's free, and it works. The vaccine can put an end to the pandemic and bring about a return to normal that we all so desire. And I don't know about you, but a return to normal sounds pretty good to me right now. So please, it's time. Let's put ourselves back on track and put COVID behind us once and for all. Thank you.
Thank you, County Executive. I'm Madison Mayor Satya Rhodes Conway. And like the county, the City of Madison is joining the growing group of employers who will require that our employees be vaccinated. City employees that are not vaccinated against COVID-19 will have to do weekly testing and show proof of a negative test. We're doing this, in short, because vaccines save lives. They are safe and effective, and they are the best tool that we have to prevent severe COVID-19 outcomes. The first line of defense with a vaccine is that it does reduce your chance of contracting COVID-19. The second line of defense is that if you are to get one of those rare breakthrough infections after you're vaccinated, your risk of severe health outcomes is lower if you have been vaccinated. So we need everyone to get vaccinated. Our city employees are here to provide services to everyone who lives in Madison and to keep our city safe, healthy, and thriving. We can't do that as a city government if our employees could also be spreading COVID throughout the community. In the city of Madison, we know that approximately 8 out of 10 people who are eligible have received at least one dose of the vaccine. And based on survey data, we believe that 9 in 10 city employees are vaccinated. But we can do better, and we must do better, because this disease is only getting more contagious. Those that aren't protected by the vaccine are at greater risk for severe illness, at risk of being hospitalized, and at risk of dying. We've already lost too many people in our community and in this country already. We have a safe, effective, and easy tool. That's vaccination, and it protects us from getting very sick or dying from COVID. We need to use it and use it to its full potential so that we can protect ourselves and each other from severe outcomes. We have to do everything in our power to reduce severe outcomes and death from COVID-19 in our community. And that includes modeling the behavior we want others to take. That's why we as a city are going to require that proof of vaccination or testing from our employees. And I want to thank the businesses, venues, and institutions in our community who are taking similar steps to require that proof of vaccination for employees or customers. As the county executive referenced, just today, we see that 5 Nightclub will require proof of vaccination to enter on weekends. And I want to thank them specifically for being a leader in this space. And I want to encourage every employer, every venue, every institution, every business to consider doing the same. We need to get people vaccinated. I'm also extremely grateful to every single person in Madison who has already gotten vaccinated, and urge anyone who has not done so yet, whether you work for the city or not, to get vaccinated as soon as you can. If you're hesitant, if you have questions, please talk to your healthcare provider or contact public health. You can find information on the vaccines and where to get them for free at many places in our community at the Public Health Madison-Dane County website. That's publichealthmdc.com/vax. publichealthmdc.com/VAX. Don't wait, folks. Now's the time. Everybody needs to get vaccinated. Thank you.
Good morning. I'm Janelle Heinrich, Director of Public Health, Madison and Dane County. I join you today with gratitude, thankful that in the spirit of public health and for the health of our community, more employers and businesses are recognizing the importance of vaccination. Proactive steps like these are what has helped our county emerge as a leader throughout this pandemic and be recognized nationally for our vaccination efforts. We are amongst the most highly vaccinated communities in the country, but it doesn't mean that we are out of the woods. The Delta variant has emerged as the predominant strain circulating in Dane County. Over the past month, we have learned more about how transmissible Delta is. Our 7-day case average has increased from 7 on June 15th to 66.9 today. The good news is that even though more people are testing positive for COVID and our percent positivity has risen, we are not yet seeing this translate to an increase in hospitalizations or deaths, like in many areas of the country with lower vaccination rates. And hopefully we won't, since our vaccination rate is so high. But we know that Delta can spread easily, and to unvaccinated people even easier, which makes it even harder to avoid, even if someone has gone the whole pandemic without getting sick or vaccinated. The single best tool we have right now is the vaccine. All 3 vaccines remain effective tools in protecting you from severe outcomes. Although you might be hearing about breakthrough cases, the protective shield of the vaccine is still strong. It is vitally important to get vaccinated, to protect yourself from severe outcomes, and to protect others from infection. And you can reinforce that protective shield against Delta by wearing a mask inside during gatherings with people outside your household, such as a store, a concert, your place of work, or school. But here's the bottom line. As we learn more about the Delta variant, we're learning just how transmissible it is. If you're unvaccinated, this virus will likely find you. I'm not saying this to scare you. I just want to underscore our current reality when it comes to this pandemic. That being said, the virus may also find you if you are vaccinated. Brand new research from last week suggests that people who are vaccinated, who get COVID, who may be able to transmit COVID effectively. But the difference is your body will be better prepared and better equipped to fight it if you are vaccinated, ensuring a chance for a better outcome. So together, we can protect ourselves and each other. Please get the vaccine if you haven't, and please wear a mask indoors. Thank you. And I think we'll entertain questions.
So we have one question from Robert Chappelle. And then from Abby Becker. Rob?
Hi, thank you. Is there a timing or is there a deadline where for both for the county and for the city that people have to be vaccinated by a certain date, or how's that going to work?
For the city, we will be implementing this new policy over the course of the next week or two, and more details will be forthcoming on that. We need to communicate directly with our employees first.
Same with the county. We expect within 2 weeks. We're just working out all the details as we speak.
Thank you. Treasurer Priestley, do you have any sense as to how many of your employees are currently vaccinated in the county?
We do not. We have not surveyed our folks. You know, if you look at the general population, we have, every reason to believe it's similar to the general population, but we have not surveyed them.
All right, thank you.
Thank you. Abby?
Yeah, my question was also, when is this effective? But it sounds like some of those specifics are going to be worked out over the next 2 weeks.
Yeah, that's correct.
Okay, great. And then just to clarify, for members of the public coming to city and county buildings, the rules that they should follow would be to mask up. Is that correct?
Yes.
So members of the public won't be asked to show proof of vaccination or a negative COVID test to enter city and county public facilities?
Not at this point, just a mask mandate inside county facilities.
Gotcha.
And for the city, just for the city, we're at this point, we're just requiring masks for our employees. If they are on duty anywhere and inside with people out not of their household. So we're not requiring masks for the public in city facilities at this point, although that could change. And we're not requiring proof of vaccination to enter the buildings.
Thank you. And just one other question. What were the rules prior to this announcement for city and county employees in terms of, in terms of vaccination status and masking?
Well, for the city, we've been through a series of things over the course of the pandemic, but most recently, we were not requiring masks for folks that were vaccinated. And allowing staff to choose whether they wish to wear a mask or not. And we had not required vaccination, but as you heard, we did survey our employees to see what their vaccination status was.
Thank you.
Looks like Rob has a follow-up, and then we have Shemaine Mills as well.
Yeah, thank you, Mayor. You both, all three of you are just asking people to get vaccinated if they haven't, even beyond your own staff. That's easier said than done for some folks. That we're still seeing, the general population is getting to close to 70% vaccinated, but the Black population is still below 30%. Is there anything new in the works to try to bridge those gaps?
I just want to, Janelle, maybe check that data. I think the rates in the African-American population are higher than 30% at this point. I think it's closer to 50. And then while Janelle is getting the numbers, we have, public health is making available pop-up clinics all across the county, and partnering with a number of different organizations, particularly targeted at communities where vaccination rates are lower, to make vaccine available to them. And vaccine is available through healthcare providers and pharmacies as well. So there are a number of opportunities for people to access the vaccine in or near their neighborhoods. But we are very focused on the disparities in vaccination rate and making sure that we're reaching out to communities, particularly communities of color, and understanding what the barriers are for them so that we can overcome them. Janelle, did you want to add anything to that?
I think we're closer to 40% for our African-American community, but no, I would just echo, I appreciate that. We haven't stopped in engagement with community stakeholders and neighborhoods throughout Dane County, especially with communities of color, to identify strategies that might work for them if we haven't been able to overcome the gap that we're seeing so far. So this is an area of incredible importance for our community and for our health department to work collaboratively to close that gap.
Yeah, I apologize. It's 28% statewide, but 38% in Dane County. So I appreciate that answer. Thank you.
Thank you. Now we have a question from Shemaine Mills. Shemaine, you should be able to unmute yourself now.
Okay, good morning. Can you tell me how many employees there are at both the city and county level? Is there a penalty for non-compliance? And are any of these workers currently doing their job remotely?
Joe, you want to go first?
Sure, there are about 2,400 county employees, and this would be a work rule violation if people do not adhere. And this will apply to everyone, even folks who are working remotely, because they could get called into the office. People who are working mainly remotely now often or may have to stop by the office. So this will apply across the board to everyone.
And for the city, we have about 2,800 employees. And we've had at the height of telework, maybe about 40% of them teleworking. At this point in time, we're transitioning folks onto individual telework plans. So that number is already down and will continue to go lower than that. But like the county, we're requiring this across the board for all employees, regardless of telework status. And similar to the county, if people fail to either provide proof of vaccination or the regular testing results, that would be a work rule violation.
And what does that mean? Getting written up or being suspended? What's a work rule violation mean in terms of discipline?
It depends on the individual case, but yes, it would start a discipline process.
Thank you.
We have another question from Abby.
Yes, I think this is actually my last question, but a question I think mostly for Janelle would, and that is, are there plans right now or considerations, thinking about further restrictions, regarding masking or, gathering limits? And then I guess along those lines, also what measures, does public health look at to make those decisions?
Thank you. Yeah, so we're at a different place today in the pandemic than we were a year ago. And that doesn't mean that we would not consider any further policy interventions as we have in the past. But, we are not seeing yet, and hopefully we won't, our case activity turn into more hospitalizations and severe outcomes. And all of those things, as I mentioned, the percent positivity, the COVID activity and hospitalizations are examples of things that we do look at, and vaccine rates to inform our decision making and our recommendations. So, and how do we think about? Unfortunately, the reality is this virus is here, and what are the things that we need to do as a community to live with it and to continue on with our daily lives, if that means wearing a mask, to reduce our risk of transmission and illness, and getting vaccinated. So these are the things that we really want to lean into and support have happen within our community right now.
Thanks, Janelle.
All right, Rob, your hand is still up. Did you have another question, or is that left over?
Sorry, that's left over, but I did think of another one. Somebody on Twitter just asked, what about testing? Is there any thought of increasing availability to testing, or are we putting all our resources into vaccine and vaccine distribution?
So we have and still have very sufficient testing capacity, and we have been, it may not be just from the health department. You can get tested at with your healthcare provider. We have a network of pharmacies in and out of Dane County that we have supported coming online to offer free accessible testing. So it's absolutely a strategy that we are continuing to support, and we need to have available to us to assure that we're capturing and identifying folks who may be ill and then preventing subsequent transmission of illness. So we are back in that multi-pronged approach with having a team, a large growing team of contact tracers that never went away, providing testing support and vaccination to our community right now.
Thank you very much.
All right, thank you. I don't see any other hands raised. Are there any other questions? All right, if not, thank you all very much for joining us. And once again, everybody, please go get vaccinated if you haven't already. Have a good rest of your day.
Thanks, everyone.